Welcome everyone. I'm delighted to see so many of you have made the effort to come out on a very cold winter's night into a very cold hall. Greatly appreciated. I'm acting merely as the coordinator for this meeting on behalf of a number of people in the community and on behalf of the doctors, of course. Just some very quick meeting rules, housekeeping. The meeting is being recorded. You will have copies available to you from the online centre in Dover on Thursday. Those of you who would like to send copies to other people, please go up to the online and do so. You're most welcome. All of this meeting is open to the public and all of the results will be made public. We hope to finish by approximately 8:15, given that it's such a cold night. It will mean that we need to keep on track. Those of you who have an agenda and have read it will notice what we're attempting to do and where we're hoping to go. Would you please be very careful that the meeting is not asked to consider or discuss any matters other than the continuity of the Dover Geeveston Medical Centres primary health practices in this valley. That's why we're here. I have a number of apologies. One that I will bring to the notice of the meeting is that the Huon Valley Council General Manager and Acting Mayor Sally Doyle were invited to attend the meeting and both of them regretfully apologise for not being here tonight. I would like to thank though the councillors and the council staff who've made an effort to get down to hear some of the concerns of this community. We are very grateful that there are some people who have come. It's my very great pleasure to introduce the chair of the meeting tonight, Mr. Jim McCormick, who's travelled down from Hobart. I don't know how many of you would be aware of Rostrum, but it is a very important training ground for public speaking and for chairmanship. And Jim is an old hand and I am delighted to welcome him here. He will give you some guidance as we try to work through the agenda in the quickest possible time. Jim.
Well, I have a microphone and I have a bell, so I'm in my element. I like to do this kind of thing, and thank you for having me. I just have to correct Jen on one thing. I actually came up from Hobart, not down. Dover is not down. Dover is a great place. And thank you for having me. I want you to think of my role as your servant, and think of me as the servant of the meeting, not of individuals. In other words, you've all come together because you've got something important to discuss, and therefore you need to get through in that time some guidance and someone to push things along. That's my job. I'm not here to tell you what to do unless you happen to be a person who comes up here to speak in the second half of the meeting and you go longer than 3 minutes. If you go for 3 minutes, I'll do this. If you go longer than 3.5 minutes, I'll do this. And the reason I ask for that is because it's important that you respect the meeting as a whole. In other words, everybody who wants to speak ought to get that opportunity if we possibly can fit it in. And so respect the meeting means respect the fact that there are others who may want to speak. And then if you have an opportunity to get up and speak, think about how you can say or ask your question in a way that gets through efficiently and quickly. So make it a clear question, make it a clear statement of what you want to say, and hopefully it will take less than the 3 minutes. As you can see from the agenda, there's two halves to this meeting. The first part is for people you know better than I, Dr. Eve, who's retired, and our local pharmacist, Fred, and Dr. Patrick are going to have an opportunity to talk to you and hear your questions in the first half, and then the second half of the meeting is about what are we going to do about the things you hear, or what are we going to do about the things you already know are important and you want to tackle it. You want to have your opportunity to say to the rest of your community how you think we can proceed. So I hope everybody's clear on that. My role, if we get to the point where anyone wants to move a formal motion, then I will immediately adopt the practices of proper meeting procedure. I'll call for a seconder. I'll call for people to speak for and against the motion. You will have one opportunity only to speak either for or against the motion. But that's a formality we'll worry about if we need to. The most important thing is that you hear what is coming from your local primary caregivers, and then you can ask them questions at the end of each bit, or you can save it until the second part when you have an opportunity to talk about what you think should happen next. Let's start with Dr. Eve, because she's got to give you some background on where things are at from the point of view of the medical professionals that are providing your services here.
Thanks, Jim, and thanks everyone for coming tonight. I think most of you know that I've recently retired, and I'm here as a resident of Dover and also as the president of the rural. Okay. So I'm here as a resident of Dover and also as the president of the Rural Doctors Association of Tasmania, which is an organisation which tries to improve the health care of rural Tasmanians. So I'd like to start by acknowledging the traditional owners of the land on which we meet tonight and pay my respects to their elders past, present and emerging. So we're here to talk about primary health care. So what actually is primary health care? What does that actually mean? So primary health care is basically the health care that you need from the time that you're born to the time that you die, which doesn't involve being in a hospital or seeing a specialist. So it's pretty much everything else. It requires a team to carry out that primary health. So everybody from doctors, nursing staff, physios, exercise physiology, dietitian, diabetic educators, psychologists, mental health workers, the pharmacist, CTAC, community health workers, and probably others that I've forgotten. But it's very much a team activity. So what happens somewhere like Dover, where obviously the worry is that there may not be a permanent doctor here, how does that impact your primary health care? So one of the issues is becoming reliant on locums. As you know, this can mean that you're seeing a different doctor every time you go to the medical centre. And one of the big issues with locums is they're very expensive. Now locums are, for the most part, excellent doctors who do a really difficult job. They're away from home, they need, transport costs, accommodation and so on, which is, why they cost more. And unfortunately, the money that we get from Medicare to run the medical centre doesn't cover that cost. There are also some things that it's quite difficult for a locum to do who doesn't know you. And just as an example, we have inpatient beds in Dover, which are used for things like if you've been in the Royal and you're not quite well enough to go home, but you don't need all the fancy services they have at the Royal, you come back to Dover where you recuperate before you go home. Or you might be admitted from home for a condition that doesn't require all the services they have at the Royal but can be managed in Dover. Now the other thing is palliative care, which is very important so that people can die with dignity near their home. Now in order to use those beds, a doctor has to go through what's called a credentialing process, which means that the health service assess their skills and experience to make sure that they can look after inpatient beds, which is a bit of a process and not all locums go through. So those kind of services may be impacted by having locums. So in terms of the requirement for locums, and why can we not just get another permanent doctor? So recruiting doctors to places like Dover is difficult, we know that. And what we need to do is make Dover more attractive than the other 60 or so places that are looking for doctors in Tasmania at the moment. And one of the factors that impacts on that is the current building that we work in, which is not fit for purpose and hasn't been. That's been recognised for some years. The Huon Valley Council have made plans. They've put in grant applications over the years that I've been here, most of which were unsuccessful. However, in the last state election, the state government recognises this was something that did need to be done, that Dover did need a renovation to their medical centre, and promised $1 million in the state election in order for that to happen. Now that was over 18 months ago. As yet, there's been no start, there's been no tenders put out to do that. And as far as I'm aware, it was only a month or so ago that the deed was signed to get that money. So there seems to be quite a big delay in what's happening. When you consider, and I know it's maybe comparing apples and oranges to some extent, but the Sailing Club, which got money promised at the same time, has already started their building and made some progress. So that's one of the issues that impacts. So it's one thing to say that the medical centres will remain open, but what's important is when you go through those open doors, what service are you going to receive when you get through? If when you go through those doors you want to have a medical service that fills your needs when you have those needs, in a timely manner, then I think every person in this room needs to think about what needs to be done, and every person needs to be looking at taking action to actually do something to try and get action happening on these issues. That was all I was going to say.
Use my back, please. I'm standing here because I want to invite questions. Because this is an echoey space, it's almost impossible to have a little roving mic that we take out to you if you have a question. So if you would like to ask anything of Dr. Eve, please stand and I'll acknowledge you and then come out here so everyone can hear what it is you want to ask. Does anyone have a question? Gentleman up the back. Yep. I'll ask you to come forward next, sir. No, I'll get this man first. He got his cane in here very quickly, so.
I was a police officer for 41 years in Western Australia. I had a breakdown with PTSD and I'd come over here to relax and get over things. And I went to Jubra to start with, then I came down here. The medical centre down here has been absolutely brilliant. The doctors are absolutely phenomenal. And the last doctor I've been seeing is Stephen Johansson for the last 12 months. Unfortunately, he's going. And at the end of July, we haven't heard from the council who's going to replace him. Same as we've got a replacement for Eve. We haven't heard from Patrick who's going to replace him. So the council are saying we're going to keep the place going. But what are they going to do? I had the same situation back in Western Australia, out in the country, where we couldn't keep doctors. This is back in the 80s, and it just doesn't work. Now we've got a system here where we've got I can't say too much about the council because I'm not really, don't feel that they're very active on what they're doing, but they say that they're going to do the right thing, but they haven't done anything. They knew that Stephen was only here for 12 months. Where's the replacement? They are not fulfilling what they know has to be done. And we've got a great chemist, we've got a great medical centre, but they aren't doing the right thing for any of you people. And I mean, all right, I suffer from PTSD, I'm in medication, everything like that. All right, I've been suicidal, big deal, everyone says, but I've been helped out immensely by the doctors here, and I think it's incredible that they're going to let us all fall down, because we're just a little minority group down here in Dover. So I just feel that it's just not right that the council is not looking after any of us people here. And that's about all I can say. I think my 3 minutes are up, but thank you very much for listening to me.
Thank you.
I can't ask Eve for a question because Eve was one of the great doctors here, and my wife got seen her before she retired. So,
Thanks.
we've had great doctors here, and I hate the fact that we're going to lose them all, and no one's going to give us new ones back.
Okay, well, let's get to that, because that's the whole reason you're here. George, could we move this microphone one side or the other? Because I feel awful that it's behind me all the time. I'm sure people will be more comfortable if they can look at it while they're asking me questions. Thanks, mate.
So you had a question for Dr.
Oh, thank you.
I want everyone to hear what your question is.
I just wanted to know, like you said, that they've been given $1 million to upgrade the centre. Who's looking after that?
I believe it's still with the state government currently, because I'm not sure where it's at, but it's only a month or so ago that the Huon Valley Council signed the paperwork necessary to get the money.
So still all going back to the council?
In terms of the actual doing the development, will be the Huon Valley Council, yeah.
Yep. No, that was all mine. I just wanted to know who was holding the money. Is it the other places are getting done? How come this one down here's not getting done?
Yeah, so the Huon Valley Council are responsible for the renovations.
Does anyone else have a question specifically for what you've heard from Dr. E? Okay, thanks very much. We'll ask now. We'll ask now for your local pharmacist, Pharmacy Fred. Please come and give us a different perspective on primary care and what is going to happen if nothing changes. So, thanks, Fred. Over to you.
So, in terms of rural healthcare, pharmacy is sort of another cog in the whole picture, and like Eva said, it's hard to get healthcare professionals to come to rural areas. So the role that the pharmacy fills is to sort of fill the holes so that we can give the service and the help that the community needs. The importance of having doctors and permanent doctors and stable doctors is immense. The working relationship that has been built up over the years with a number of doctors. When I started, we had Demuth, it was Rhonda, then there was Eve, and Patrick, and Stephen, and now Lucy. So there's sort of been a handover of the baton, if you will, in terms of that working relationship. And the relationship is important in the sense that we solve problems on a daily basis that is aimed at improving people's chronic care and long-term well-being. So chronic care is basically things like diabetes and cardiovascular disease, and the aim is to maintain and, if you can, improve that situation over time. With the situation that you don't have a stable GP and you end up with a turnstile of locums, that continuity gets broken. And it's like Eve said, they're not bad doctors, they're excellent doctors, but because of the continuity that is important in helping and advancing people's health, it's much harder to do that. And you end up in a situation that where acute care is pretty much well addressed, but that long-term care falls a little bit by the wayside. So from a pharmacy perspective, it generates a lot more pressure, and I'm bound by quite a number of legal requirements, and my scope of practice is quite delineated, so I can only do certain things, and it from places where we know that they've had trouble with doctors or stable doctors, it has generated a lot of pressure on the pharmacy, and it's quite a difficult situation. So from my perspective, I just hope that there is an avenue to look at other models than has been proposed so far to sort of solve the situation of the lack of doctors that is on the cards for the future. So I'm hoping that all avenues are being explored by council, on a council level, on a state level, to help address this situation.
Thanks, Brett. Now, does anyone have... Can you hear me all right? Doesn't matter if it... Someone has a question here. Would you mind coming forward, please? Is that possible? The dog can come to you if he's yours.
Just a question, Fred. Two questions. Are you sticking around? And what do you mean by the models? Models previously?
Yes, I have no plans of going anywhere. In terms of other models, I think that there's obviously a challenge in terms of the funding, and other models needs to be explored. There is a little bit of movement in the area in terms of what the state has announced in terms of primary healthcare. We don't know a lot of details. In fact, there's very little details, but there is a little bit of a movement in terms of who's going to fund what and how it is to be funded. So the problem that we're facing with rural healthcare is that we are working with smaller numbers. So the throughput that in a lot of ways is needed to keep practices and pharmacies viable, it's not really there because of just population. So there needs to be different models considered for different areas, and there seems to be a little bit of a movement and a little bit of an understanding from politicians that this may be needed, but again, we don't know the details of that.
Another question from over here. Any questions on this side? Thank you, sir.
It's a good thing that Fred is staying here. My name is Michael England. I live down in Southport. I came over from Signet, and I found that in small townships where state-run medical centres don't run out of lack of money. Doctors are moving away out of whatever reason. Private conglomerates, mainly from the mainland, they buy them up, and the dynamics change. And bulk billing, which a lot of us need, becomes more difficult. And I just wonder if, because money for the council to spend, because they spend it also. Let's not get into that. Is one of the models somewhere in the picture that this centre actually gets privatised and the dynamics will change? That because the guarantee is not that there will be permanent doctors as well. Because permanent doctors, especially from the private sector, they also want a certain salary. I don't know, it's quite often it happens that these small centres just get sold off by the councils.
Yeah, I'm probably not the best person to answer that, but
I was just asking if that is a model which is somewhere in the periphery, if somebody knows.
No. Not suitable.
it's probably a question for Eve or Patrick, but I think it's...
Does anyone else have a question specifically for Fred in his role as the pharmacist and what he's talked about, and the need for the connection between medical services provided by doctors and nurses compared to what he does in the next stage of that process? Is your question about that, or do you want to ask more about modelling?
It's more about models.
Great, because that's what we're getting to. Please thank Fred. Use my bell. Your question is related to models as well?
No, it's not. It's a question I'd like to ask Dr. Eve that has only...
Okay, well, maybe we can get back to that in the second part, because I want to invite Dr. Patrick up here now. And as you know, there's been some change in the last week or so in terms of what he's flagged and about his pending finishing up at the end of the year. What it tells me as an outsider is that you are facing change. And you know, there may be many of you who've lived here for most of your life, if not all of your life, and you love the place, and you don't want it to change necessarily. But of course, as you know, there are things called tourists who come here, at least in the summertime. There are businesses that employ people who don't necessarily live here. There are more people looking to live here and change their life in order for something better. So you're getting change coming at you no matter what. And with the first two speakers, we've heard about the changes that are necessary, and the word models has come up in both the conversations. In fact, we've had questions about models, and there are yet more to come. So let's explore with Dr. Patrick what it is that he sees we can do. If you've got a question you've got burning for him, he told me earlier that he doesn't want to speak to you, he wants to hear what your questions actually are. If you've got a question for Dr. Patrick, invite him up, and then I want to hear what your questions are for him. Come forward, please.
Thank you all very much for coming out tonight. It is a cold night, it's a hard one, and I'm absolutely stunned by the people here. I believe I once saw a movie about the girl who kicked the hornet's nest, is it? And I feel like the GP who's kicked the hornet's nest a couple of times to cause this sort of a ruckus. If you look at what I actually said, I said I was handing in my resignation to resign on the 23rd of December of this year. I think any of you with some thinking about why would he resign 7 months in advance, you will probably guess that there was some underlying reason for what I did. I just want to go through the elephant in the room, and that is why. So I did it because this is a personal feeling that I wasn't sure that maybe the people who I thought should be listening were actually listening to what was being said to them. And we're in this, Me Too movement, so I felt entitled, although I'm not female, I felt I should have a Me Too movement and have my feelings listened to and felt. So I thought I would make a resignation. I'm trying to make light of this, but there was a serious thing behind it. I wanted some of it. Now, it has been said to me that maybe I've caused trouble, that I have caused anxiety, that I have caused particular anxiety amongst you folk, and I have probably seen you all maybe down in the yacht club, maybe in the RSL, and possibly once or twice in a place called the Dover Medical Centre. It has not been my intention to make any of you feel anxious or nervous. Okay. So that's why I left. Sorry, that's why I offered my resignation to be the martyr to the cause to an extent. And I just want to acknowledge what Fred said tonight, because this is the first night ever, first day in my life that someone has called me stable. So I am a stable, and I want that documented, please, whoever's documented this. So, considering my stability, so where did I want to go from here? Well, you probably all know, I bought a place here, I live here, I love being here. I've been working here for about 11 years on and off. I was Rhonda's supervisor, her mentor. She was brilliant. Unfortunately, she left. So it's her fault that you now have me long term. And I have planned to stay here till I retired. But I read somewhere in one of those medical journals where people who retire can sometimes die. So I thought, don't retire and I'll live forever. Maybe. But I want to stay working here. So I told the council I was not retiring, I was resigning, and I think that's an important thing. The good thing that has happened since then is that there has been a lot of discussion, and I hope the discussion continues from tonight. But I'm going to say a few other things, and this might, I hope, following on from what Eve has said, I want you to think about yourselves as well. So who's to blame here for all of this? Who do we point the finger at? You all want to point the finger at that elephant in the room, the council, yes? The council's fault? Why hasn't the council got another doctor here? Why hasn't the council? Why? But you know inside it's not the council's fault, in the sense of the council didn't get me, the council didn't get Eve, it was an accident of fate. There's the reason, sitting behind me. I came here because Rhonda left, it was an accident. The council had nothing to do with it. Someone mentioned Stephen Johansson. He's a fabulous doctor. I'm sad that he's leaving, but he's a registrar. He's a doctor in learning to be a specialist GP like Eve is. And part of that learning is to be here. He's been here for 18 months, but he needs to go somewhere else to do some other learning, because otherwise, all he'll know about general practice is what Eve and I have taught him. He needs to learn something else. So of course he'll move. And the next registrar will come. Who gets the registrar? Is it the council? It's not the council, okay? So it's a very complex structure, and primary care is incredibly complex. And I'd like you to try and look beyond. And what I want you to leave here tonight with is, how do we get rid of Patrick, okay? I want to vote myself out of the job, so that when you come to the practice or the centre or whatever you want to call it, as Eve said, you're coming in for a service. It's not quite like your car where you bring it in and we can just open it up and whatever. But if you were coming in for a dressing, you don't need to see me. Why do I poke my head in the door when you're in with the nurse? Have you ever wondered that?
Medicare.
Who said what?
Medicare.
Yes? Medicare. Bloody Medicare. Okay. What keeps the lights on in the building over there? Who pays Annette's salary? Medicare. So we have a fee per item of service, and what keeps everything going is when you walk into the building and the doctor has to see you. It's ludicrous. You come in, maybe you need some help with Centrelink. You might need something else. Why are you seeing the doctor? Why not see a social worker? Why not see the physio? Why not see the nurse and not have the nurse call the doctor? doctor in just a wave and say, hello, I'm the doctor, this is Medicare, can I claim a Medicare bill? It's ludicrous. So maybe we can change that. And that comes down to models. And I will talk about models if I don't get the bell ringing at me in a second. 3 minutes for an Irishman, is he cutting? We can make an answer for it. But this is a serious point. So when you come in, everything from Medicare is what pays for everything. So when you come in, and the fee at the surgery is $75. Someone comes in, they don't pay the fee, they use this term called bulk billing, it's about $40. We live in an era of 10% inflation, yet the practice is here trying to run on about 60% of the fee. Not going up, it's going down. And that is part of the reason why the council is in the red to about 400,000. Yes, the council have said, and they put it in their thing, they will pay that 400,000 next year. So I'm going to say, thank you, council, for putting 400,000 into the practices in Geeveston and Dover. But you've got to reflect that it's not going to be there forever, because I'm very sure the people of Hewlett are saying, why are we subsidising the people in Dover and Geeveston? And if the medical practice, that's a private practice, Oaker, in Hewlett says, hang on, the people down there are getting 400,000 of public money from the council and we're not. Maybe they might ask for 400,000. So you can see it's a complex thing. So don't think it's going to be easily answered. I'll speed up now. So I have a vision. I'm not Martin Luther King, but I have a vision, okay? And I'm not on drugs, I promise you, okay? Exactly. So the vision is we need to change. If we don't change, yes, there will probably be no doctors there. But not just no doctors, there'll be no doctors, there'll be no net. And without a net, the building won't function. Okay? We all know that. Thank you, Annette. Okay. I just like embarrassing people when I can. So everybody else will be gone. So we have to have change. And I see the change, and the beautiful thing, the Premier's media release at the end of last week, it was like manna from heaven. Reading it, it's all the stuff we've been talking about. At the moment, your services here are determined by the funding. They say, here's your fee per item, this is what you got, and we've got to try and get your services. It's back to front, it's the cart before the horse. We should have, what are the services? Not that what you want, but what do you need? Okay, we all want nirvana. We're not going to get it. What are the services that this town, sorry, not this town, this area south of, let's say, Port Ewan, because it includes Geeveston, what do we need? And then look at the funding. And that is the biggest change that has to happen. And that is why I said, I'm going to resign on the 23rd of December because I want something to change. I have been asked by some people not to say too much, but I had phone calls today from Professor Michael Ashby and from Bruce Edwards from DHHS, and they want to talk about different models, okay? I've been asked by others not to talk too much about it, because again, I don't want to build you guys up and then cause more anxiety later if it doesn't happen. But there are going to be changes, because if nothing changes, if the building isn't done, if we don't end up with one practice south of Port Ewan, I won't stay, because it wouldn't be worth it, okay? It just won't work. At the moment, Fridays there's no doctor in Geeveston, so we see people. Can we access their files? No. How crazy is that? A set of files in Geeveston, a set of files in Dover. So now half the people south of Port Ewan have got a file in Dover and a file in Geeveston. Last November we had a meeting, we agreed, yes, we were going to have one practice, two sites. We still don't even have a name. So, I'm happy to take any questions, but I want you to leave tonight with a sense of optimism. But the sense of optimism can only be garnered if you yourselves, I think, if you yourselves make an effort as well, and the effort is to talk to the people that matter. I would suggest don't complain to them, but say, here's the solution, okay? Nobody likes a problem, they want a solution. So I've emailed the Premier, God knows who's going to look at it, it'll be one of his minions somewhere. I've said, here's a solution to the problem in Dole, because it became a problem because the ABC mentioned something. All right? And that's what we have to do. Sometimes you have to push things. But there is a solution. We can help it. And can you imagine, and I'll leave you with this thought, right? South of Port Huron, you have this hub of excellence for primary health services. Not doctors, primary health services, which I hope might include me for a little bit longer. Maybe somebody else, but it would have nursing staff, whoever else you need. Eve mentioned them all earlier on. But I would suggest that we should include UTAS, University of Tasmania. We should include Tas Ambulance. And with time, when you have a model, let's take it to people like, I don't know, have you heard of TASL? Have you heard of Huronac? Have you heard of, I don't know, the place called Sustainable Timbers? Don't mention them, okay, maybe, I don't know. But people that might be willing to contribute something towards an ongoing community, what that lovely word, sort of like community centre, community services. So that's what I see as a vision, okay? And I think now that it is possibly obtained. But I'm not so sure it's obtainable if we just keep, shall we say, screaming at the council. But if we stay nicely to the Premier, maybe to our Mayor, and the people who matter, the people who got this stuff, the money, please, can we change the funding? Can we change the model? And can we get something that will fit here, that's fit for purpose, and we could use that as a pilot project, and then maybe we could take that and give it to OOS. We won't charge them for it, we'll just give them the idea. Take it up the East Coast. So that's what I think we could do.
I hope you heard that. You have a choice. If you sit back and just let things go on as they are, down she goes. Down she goes. First you lose one bit of the primary health care, next you lose another bit, then another one doesn't become sustainable. Or you can take the Dr. Patrick view and work it up. Make it something that you can be proud of as a community because it's yours. The thing I just heard is about this idea of integrating a whole range of services and integrating it for the community as a whole. And to me, a model, and I'm conscious of the person over here who had a question about models, the model is something about perhaps saying, what do we need for us to be able to function as a community and take care of each other? And what's the best way to use the money that we're going to need to do that? It's like a different recipe. You know, there's more than one way to bake a cake. And believe me, I don't bake cakes, but I know that different people make them differently. How do you get your crumbs together to make your cake? Now, I want this person, ma'am, you had a question about models? Do you have actually a statement you wish to make,
but it is
reflecting what you've just heard?
It's not a question about the models, but it was a question regarding the doctors and the allied services.
Please come forward so
no,
everyone can
go
hear
on.
what it is
You're in.
of concern.
Hi, my name's Ange McLean, and I wanted to ask either Patrick or Eve, whoever could answer it for me. You mentioned about the allied services, and if we don't get together as a community and work towards trying to get a better model, are we at risk of losing all the services that you've brought into our community in the last few years? I've been a recipient of some of those services that have been brought here that we didn't have, and it was really difficult to go to Hobart several times a week for services that we now get within the community. And if we don't go with one of these models, are we at risk of losing those services?
So I think the short answer is no, we're not going to lose the other services. I think it's very important that you all know that the centres are not closing. Okay, please, they are not closing. We're just having arguments about how we might do it. Remember, I am an employee of Huon Valley Council, and I'm not here speaking on behalf of Huon Valley Council. I am not the employer, I don't employ anybody, I'm an employee. But I have never heard anything about losing allied health services or anything. We would like to embellish them, we being those involved in discussing about primary health. And as I say, because of what's happened, and I do apologise, but because of what's happened, there's a lot more talking and a lot more discussion about the future. So I would be very positive, Angela, that when, I don't know, things do move slowly.
Thank you.
Okay, does anyone else have a question of Dr. Patrick, or a similar question to the one you've just heard?
To your left.
To my left. Now, please come forward. Both of you can come together if you want.
Hi, my name is Jessie Crow. I moved from this district approximately 23 years ago. This district was having problems then, and tonight it sounds like that they haven't been addressed for all these years. It's still going on. One question I'd like to ask Dr. Patrick. I know this is not part of the medical centre, but with our emergency room at the complex, if that was brought over to the medical side of it, that would be another avenue to create getting permanent doctors down here to have that emergency medicine aside. Do you agree with that?
I would sit in the fence and say yes and no. There are those who would come and say yes, like myself, and I'm speaking now for Eve, because I like speaking for Eve, like the emergency medicine side of things, because we like, and that's why we're part of the reason why we're here, as well as loving the community. But there are some docs who will not come here because, oh, there's an emergency room. There are some nurses who won't work at the nursing home because, oh, there's an emergency room. And particularly, of course, the big fear for all of them is the young sick child. So it can be a negative. For me, overall it's a positive. And when I talk about a hub for undergraduate and postgraduate education for primary health services, I'm really talking about rural generalist training for those who are interested in working in rural general primary health care, because it is just much more enjoyable, okay, than working in an office in the city. So having the room would certainly attract more of them, I believe. We must remember that there'll be some who will look at it and see it as a negative. The building will be renovated, I am very sure of that. When? I don't know. I haven't seen the drawings. It's 3 years since Annette at the back, I keep picking on Annette. 3 years ago at the back, Annette drew out some fabulous plans, and I said, what a great idea. And that's where it started from. But I would suggest that next year the building will probably start to change, and it will incorporate that emergency room, but the emergency room still has to be part of the nursing home part as well, because who's going to be the nurse at 10 o'clock at night when someone comes up with their cut finger, sick child, sore leg? It will be the nurse in the nursing home. But you will never be able to afford to have a doctor here 24 hours a day, 7 days a week. And I don't mean that we charge that much, it's just not going to work. As was said, change is coming. We all know that. We accept change in all the other things in our lives. It is changing, and I'm one of the old fuddy-duddies, okay? But I'm changing. I have to change it. It won't be like it used to be. Okay. But thank you for the question.
I believe there's somebody over there under the basketball hoop who had a question. Near the basketball hoop, there you sir? Yep. Okay.
Well, listening to Patrick is music to my ears. I'm Paul Gibson from Signet and been concerned about the Dover Medical Centre for some time. and been doing some exploration into community-run medical centre arrangements. And there's a company in Victoria called CoHealth that currently runs 9 community-run health centres. They're a not-for-profit, they have 1,000 employees, and they have the know-how to make this happen. And they're moving down to Tasmania. They're starting a centre in Bicheno, and they're interested, after my discussions with them, in looking at the Huon Valley situation here. So I mean, I think that this is the sort of model we could chase up. They sound like a really good model. They have, as I said, they have the know-how, and it's all about community energy. So when you get community-run, community energy behind a medical centre, that's when it becomes attractive to doctors. Problems get solved. Finance can come from multiple sources, can come from council, state, federal, and grants, and you can build something that you're really proud of. So I think that's the sort of model that we should explore. Thanks.
Well, that sounds like we've moved to the next half of our session. Did you have an actual question for Patrick, or do you want to start and follow on from what was just said? Because we're now at the point where we can talk about what is it that we can do. But your question is more than relevant, I'm sure. So if you'd ask your question of Dr. Patrick, and we'll move on to what are we going to do about it? What comes next?
Hello everybody. I have a question. I'm a registered nurse, and I really love to train young nurses, and I also know that Patrick and Eve like to train young doctors. So my concern is that if we lose, I know that Eve gave 2 years notice before she resigned, and you're giving 6 months notice. Is there any possibility that may change and you would withdraw your resignation? That would be the first thing. The second thing is that if you don't, and we don't find another permanent doctor, I'm not sure that locums are allowed to train young doctors. And I think they can do it for a couple of weeks if there's a permanent GP, but I think that all of that training facility will go away, and so we won't have people like Stephen Johansson or Lucy coming here. We'll be basically just reliant on locums. We won't be able to train anybody that will see how lovely our community is and then potentially think that they may like to come and live here.
So that's very true, and everybody keeps talking about Stephen, but I'm fed up with hearing about this doctor so handsome. Just because he's young and good looking, but there you go. But on the serious answer to your question, when I emailed the Premier, I said that we need a long-term solution. I congratulated him on the vision that was in his media release, and I said, look, it was like basically words that we've been using, and I would be very happy to meet him or someone from the department. And it's happening. I had phone calls today. Not because of that email, I'm sure, it was just happening. So that's good. I said there's a short-term solution, and I said the short-term solution, if we could have changes that, I would be happy to remove my offer of resignation. And I said that, and I said I'd be happy to do so. But there has to be change. If there's no change, you don't want to be left in this town with an older single male doc. That is not what you want. I'm telling you, okay? I've had experience with that. You want a team that will give you services. If that looks like it's going to happen, I would love to stay, unless they fire me.
You heard it from the man himself. What he's done is trying to speed up the rate of change. That's what it comes down to. I think there's probably nobody here who's going to contest the fact we've got to change things. It's not sustainable like it is. not going to work like it is. If it gets any worse, it'll fall apart. Got to change. We've talked about models. We've got to explore different models. What Dr. Patrick has just said that I heard is he wants some short-term action and some long-term commitment. In that context, I would invite anyone who wishes to come forward and talk about specific things. You can talk about what you particularly want. You can talk about what you think we need as a community. Or you can talk about where you think you are going to take the next steps as far as personal action or group action. Because everybody needs to hear what others are doing. That's a really important way for a healthy community. I mean a community that functions in the way it communicates with each other. It's important for how you progress this. So is anybody wanting to come forward, please? Gentlemen here.
Evening everybody, my name's Tony Manning, as you probably all know, Lee's partner. I just want to ask everyone in this room a question. Is if somebody gave you $1 million, how long would it take you to sign a piece of paper to get that $1 million? My next question is, how many of you would take 18 months? No hands, wonder why. We need the council to access that money, put it into motion at the next council meeting, a motion taken forward to start a tender process for the redevelopment of our community, of the hospital. Unless we get that commitment, they'll keep this going on forever. And let's not forget that there is a council re-election in September, and we should send a solid message to the council, to the councils, to the general manager, and also to the media that the Dover will not vote, and Geeveston, for any member that's sitting there and will not take any action for the Dover Medical Centre.
There's the reason why you came tonight. Here's somebody has come up with a suggestion. You can do something about that, and you can do something about it immediately. The question of the mechanics of how you get that message to council and ask for that cheque or that document to be signed so the cheque can be handed over at their next council meeting to get that thing underway, you can make it happen. So this gentleman's got a pretty clear idea of what he wants. If you agree, and you all applauded, or many of you did, I didn't see anyone not, figure out how to make that happen. You know, we often say in Tasmania, we either know a politician or we're related to one. And I'm sure that's true here. So you can figure out how to make that happen. Is there another person who wishes to make a suggestion? Sir?
Good evening everyone, my name's Ryan Doyle. As you may understand, being a Doyle, I have a lot of family in this region. I've spent a lot of years down here, myself. I'm upset to say that I haven't spent probably as much time down here as I wish. That being said, I've spent a long time in regional areas. Now something I've found, and I find down here in these regional, lower, southern, colder regions that may not get as much tourist attraction as the next, we get looked over. We get looked over hard. Now, that may be, or we may have one reason or another for that, but I also come back to, as the gentleman over the back there stated, about getting more community involvement happening. Now, one thing I've noticed is obviously the sports centre is no longer a factor. Though it's here, it doesn't seem very viable for people to use and facilitate on a general basis. Things like Seafest, something that was really good, lots of people came, the community got very involved. It went quiet. What happened? And from an outside perspective, looking in, I see that, or I should say, I don't see as much community involvement and backing as there used to be. And I'm sad to say that with the medical centres, how it's been, that the fact that we have had locums and stuff, fortunately we have had people like Eve that have stuck around, but we need to make our community more inviting for doctors to want to come down here, live down here, and help us in our community on our day-to-day. Thank you.
I would call that a call to arms. Your community, be a community. You're all different to each other, and some of you have such differences you might want to cross the street when you see the other one coming, but you're all part of a community. You've got to work together. Yeah.
Hi everybody, my name's Meg Wilson. Probably been in this situation before with the previous hospital with my husband, and Betty Norris is here tonight with her husband, who fought very hard to what we thought was to save the hospital then. Now we've got a new one. So this community can do it, and we will do it again. The thing is, we've got our professionals sitting here. I've been up there a few times, just recently, a little bit more serious. I couldn't fault anything. So from my point of view, I can't sit down and write a plan because I don't know what you want. So in saying that, for me it's perfect, obviously it's not. So you need to be able to call meetings, whatever it takes, to tell us what is wrong with it. Thank you.
Pardon? Oh, definitely, yes, please.
Oh, good one.
Yeah.
Tiny replies, it's like a weed around.
So this shouldn't take longer than about 15 minutes. And thank you, Megan, I appreciate what you said. So I'm not saying that, and I want very important to say, I'm not saying that there's anything wrong with what we're doing. I'm saying that we need to look to the future. But it's the model of funding that's limiting the services that you can get is our biggest issue. And I suppose the tardiness of change. So I'm not wanting to have different types of doctors. I promise you'll never see me with a red nose because I've got a big enough nose as it is, or anything like that. I will try and give you the same service, but things have to change, and that's all we're trying to do. And at the moment, it's just not easy.
If I can just add something to what Patrick said about change and what's happening in the community, things have been kind of ticking along, but look around Dover. There's a subdivision with, I think, 36 houses going just down from where I live. The Caravan Park, there's talk about, 42 units going in there. We've got 15 units or so that the St Joseph's ones. Dover's getting bigger and bigger, and the medical centre needs to expand to cope with that. We're barely, Patrick's flat out as it is. So change is already happening. The town is getting bigger, there's more people, there's more demand for all those services. We have to keep pace with that.
Oh, there's a person at the back in red, and then you, sir. If you come forward, please.
just wanted to say, if, like Tony says, if we could do a few petitions and put them in the chemist and the post office, that for people to sign to the council.
All of them?
There's a practical solution. It's not the only one, but it's one of the things that you can do. There's nobody who can't sign a petition to say to council the message that was suggested earlier about getting that $1 million and getting the program of
Tenders out?
managing that construction underway. Service, yeah, thank you.
My name's Mike Couch. I have to confess I am a doctor, but I'm not putting my hand up here. I've been a rural GP for probably a year or so in the past, particularly in New Zealand, and I thought it was some of the most useful work you could do as a doctor. And I also thought, under the circumstances then, I wouldn't commit myself to it long term, because there just wasn't enough support and it was too demanding. And I really admire people who, like Patrick, who've been doing it for a long term here. And I completely support his idea of needing a new model. I'm not sure, I haven't met Patrick, I've seen him around, whether he's worked under the British National Health Service, but from what my friends back there where I train see, they do seem to have a lot more in terms of nurses and allied health working in practices. And because there they don't rely on fee for service, basically the practice is paid to look after a certain number of people and then given extra funding for other services. And in a way, it seems that general practice with the Medicare fee-for-service model, as it's evolved over the last 30, 40 years in Australia, is a little bit behind international practices. And there need to be, look at other models to make it work better. And the other thing, as I've been trying to move here with my wife from Sydney for about 15 years, and we've managed it for the last 6 months now, which is the longest we've been here. And we were just saying a few months ago, thank goodness they've really got things together at the medical centre. Because when we first came down here about 20 years ago, it was a bit patchy and people were worried. And we thought, gee, if we do manage to settle here for the duration, we've got good support, because we're at the age now where we're patients as well as workers. And with the national emphasis on rural health and the deficiencies and the need for better support, I think it's absolutely time to look at something better and everyone get together and support Patrick's ideas and other ideas and really make it work. So good on you, Patrick.
Okay, is there any last questions or comments that people want to make? Because I'm going to ask, if, yes sir, you wanted to, while you're coming up, I want to flag the next thing before we close. Are there any motions, formal motions that people wish to put forward about actions that will be taken that are the wishes of this meeting? You, the representatives of the Geeveston and Dover community, so I'll invite you up then. If you have a motion, that'd be great. We'll just hear.
I'd like to say something. We're talking about models. Very few of us in here know models.
I'd prefer you came and said at the microphone. You'll be second after going here?
Yes, sure.
Got one statement and then I'll ask you.
We've heard all about models and changes, and we've had some very good doctors here. But at the end of the day, we are not here to ask for models and changes. The doctors or other departments, they do the changes. We want doctors here. We don't want a situation where they are saying we have to have change here and change there. We have 3 doctors here, and we've lost 2 of them. We're losing one at Geeveston. There's no explanation. Then we hear that it's not the council's responsibility. Well, it is. It's their responsibility to put doctors here. It's not the state government, it's not Medicare, but we've got a situation now where they're saying we have to have a new model to change this or change that. That's a load of garbage. When you start thinking about it, why should you have to change to have a doctor here? We want a doctor here, we do. And it's the council's responsibility. We pay our rates. And everyone's getting hoodwinked by a lot of the stuff that's being said today. It is up to the council to put them here, and we should be jumping on the council. We don't have to change. It's the council that's got to have the pressure put on them. They are saying that we're going to put more doctors here and we're going to do this, that, the next thing. But are they?
But are the council able to? I don't think they've got...
We've got a shonky council, but I'll not have to go into that.
No, but maybe they're not the ones to run it. Maybe they're not the ones to run it, Dale.
It's not our responsibility to change, it's the council's responsibility to provide us. We are the residents here, we are paying for it all. They should be supplying it. Thank you.
Just to reflect on that contribution, we're not talking about individuals changing as much as we're talking about the community change, because we've heard very clearly tonight that the current situation is not sustainable in the way it's done. Council take the responsibility for managing the medical centre, but they do it with a host of support from a whole range of government agencies at federal and state level as much as at local government level. We've heard that too. But it's about you, the community as a whole, telling who needs to hear what it is that you need in order to continue to be able to count on having doctors and count on having primary health care from a range of other providers. So did you want to quickly say what it is you have? Is there somebody ready to put forward a motion? I've been handed one here. Does anyone want to get into a formal motion as an outcome of the meeting? Think about that, please, because I'll ask for it again after this.
It would seem to me that Patrick has done exactly what he wanted to do, and he's resigned so that he can get something done. And he's already said he'll come back when it's done. We just don't know what it is yet. I'm not a mechanic. I couldn't fix a car to save my life, so I take it to a mechanic. How's a mechanic lay out his mechanic shop? I don't know. We need to get the healthcare professionals to look at what's needed in these models. Get Patrick involved and say, what do we need?
Yeah.
What do you need, mate?
Yeah.
Because it's him that's going to stay. Now he's talking about a hub. Okay, a hub's that thing in the middle. What comes off a hub? Spokes. Where's it go? Don't know. They're called outsourcers. You don't have to have permanent physiotherapists. You don't have to have permanent healthcare workers, but you've got to give them somewhere to work. And I think that's what Patrick is talking about. Give them a suitable environment in which they like to work, they'll come down. It's not Field of Dreams, it's not Kevin Costner, but if there's nothing there to start with and it's not a suitable environment for them to work in, they're not going to come. Do we need a physiotherapist 3 days a week? No. Should they have a facility to work from? Yes. Do we need healthcare workers 3 days a week? No. But do they need somewhere to work from? Yes. Let's look at the model, because the model will attract these people. Yes, it's about funding, but if we do something about it first and we get the model up and running, I'm pretty sure the government will come through with funding. And that could be one of the motions we put through.
Well done.
You just heard that could be a motion. So we need, if we're going to do it as a formal thing, as an outcome of this meeting, we need to, you have a motion, Penny? Yeah, well, sort of. Let's hear what you have to say. We can maybe go to the way that will work.
I've lived in Dover most of my life. And I came here tonight to find out what I can do to help make things better. Clearly things aren't as great as what they could be. So I guess, you know, from Eve and Patrick, what I've kind of thought tonight is that the best thing that we can do to help is to make some noise. So I guess my motion is, can we all kind of commit to at least contacting one of the people that are on this list to say, we're concerned?
Yeah.
It can be something even really simple, but I think they need to understand that the community is, you know, concerned and behind our medical centre, and that we want to see changes so that, you know, it's a more sustainable medical centre. So that's my motion. Can we commit to actually contacting someone, each of us?
Yep, we can all do that, can't we? Yeah. Yep.
If you're willing to sign a petition or contact one of the people on that list on your seat, put your hand up, please. We're not going to film you or record your names. There's your answer. That's the community at work. Whether or not it's a formal motion isn't the point. The point is you're prepared to do something.
Yep.
There's one here I was given, which is, I want to help keep our medical centre with no less than the present number of doctors and staff. Maybe that's what you put in your email or your message that you send to those contacts on that list. We don't want it to get any smaller or any less than we have now. That's the starting point. Another motion might be along the lines of the gentleman who talked about, we want the council at their next meeting to decide that they will sign off on accessing the $1 million needed to do the refurbishment.
Start the tender process.
That seems like a pretty simple motion.
Yep, start the tender
That comes
process.
from this community, from this meeting as an agreed motion. You've made some progress. Do you want that to be a formal motion?
Yes.
Would somebody, we've just changed tack. Would somebody please move that motion?
Moved it.
Stand up, person. Okay, is someone recording the wording in the motion?
Yes.
At their next meeting?
At the next meeting?
I'd like to move a motion that we ask the council at the next meeting to address the money that was allocated for the practice to be put in motion, and at least and to get back to the public after that meeting and let us know the results, what happened at the meeting.
We have a second. Thank you. Normal formal practice is that I ask, is anyone wanting to speak against that motion?
No.
If there's no one to speak against the motion, we don't need anyone to speak for the motion, because the assumption is you either are not going to vote one way or the other, or you're supporting it. So I put the motion. Would all those people in favour please say aye? Aye. Those against say no. Clearly, the ayes have it. The motion is carried.
Yeah.
Thank you. Is there any motion that people wish to word in the context of making sure that the current level of servicing is not lessened? In other words, you want to send a signal out, we do not want any fewer doctors as a minimum while we progress the sorts of changes that Dr. Patrick talked about.
Yeah. So I think one of the...
Come up to the microphone, please.
I think we need, at a minimum, at least the services that we have at the moment. I know personally that unless it's urgent, and Annette does a great job of getting you in, you know, you have to wait. And I'm sure everybody has experienced that. And that can be kind of frustrating because, let's face it, when we're sick, we get a bit worried, and so that then affects our mental health as well. So less services is only going to increase that. So yes, we want the status quo, but really and truly it would be nice to actually have more than what we have. So I guess that's my motion to, I don't know, can you...
While you transition.
perhaps I can suggest that the motion be that for the interim, there be assurance given that the current level of staffing and support services available in the medical centre remain at least as it is, as a minimum.
Yeah.
While we progress the changes.
Yeah, sounds good.
Is that reasonable? So we have a mover of that motion. Is there a seconder to the motion?
Yep.
Thank you, ma'am. Does anyone wish to speak against that motion? As before? Oh, you wish to speak?
It's up to us.
Yes, my understanding is the formal motions will be recorded and given to council as a record of decisions made by this meeting. Thank you for the question about clarification. If there's no one speaking against that motion, I will put the motion. Would all those in favour please say aye?
Aye.
Would those against say no? Clearly the ayes have it. The motion is carried. Are there any other particular aspects that people wish to bring forward in the form of a motion of this as an outcome of this meeting? As a member of the community, yes? Dr. Eve.
Not so much that I'm proposing a motion, but I think one of the things Patrick has talked about is these interactions between the state government and potentially the federal government in terms of the funding. And I think what we need is for the Huon Valley Council to work constructively with the state government to look at those alternative funding arrangements. So,
That could be a motion.
Something along the lines, if somebody wanted to, perhaps not me, the motion of ensuring that the Huon Valley Council work constructively with those other agencies to look at those alternative funding models. And you don't have to necessarily understand all these complicated things about models, but the bottom line is that the medical centre needs money to run and it has to come from somewhere. And so alternative funding models, because what's currently there isn't working,
Not working.
need to be looked at.
Did you want to express that motion differently, ma'am? Okay. Well, let me just deal with this particular suggestion. The motion is probably something like, we, this community, call on our council to work cooperatively with state and federal government authorities to progress the issues of new funding models for our medical centre. Does that make sense, or do people want to change that word, sir?
I think it's also, we need to get the state government to work with the federal government.
That's
all levels of government. All levels of government.
All levels of government. We want the council to work cooperatively with state and federal government authorities to progress the pursuit of new funding models for our medical centre.
We'd like to see 3 levels of government.
Yes.
Have pulled together to get these models.
The Father, the Son and the Holy Ghost. We want them to work together.
Exactly.
Amen. Okay, is there a second? Oh, is there a mover to the motion? And a seconder? Has somebody recorded the wording of that motion?
I should do. Hope so.
I think Jen's furiously writing.
Yeah, so we've got it, we think.
We've got it recorded. Good. Is there anyone wishing to speak against that motion?
No.
If there's no speakers against, I'll put the motion. With all those in favour, please say aye. Aye. Those against say no. Clearly again, the ayes have it. The motion is carried. Ma'am, you have another motion you wish to bring forward, please. Come.
Is he all right?
Eve at the beginning mentioned about how the Sailing Club had progressed with the money that they were promised at the last state election, and the money hadn't moved with the medical centre. And I just want to point out one thing, and that is that there's been a lot of work with people from the Sailing Club working with council and talking to government to make that happen. And my motion is that we set up a working group in a similar sort of way, where we have people from the medical centre and the associated medical staff, and people from the community and people from council working to get that money and models and move forward, because it's all very well, as in the last motion, where we want the council to work with the state government, but if we, if we can get representatives from this community to work with people from the medical centre and the council, then we've got something where we can actually push forward rather than just say, this is what we want. So I think we should set up a working group in this community working towards that end.
Does everybody know who this person is?
Yeah, well.
Because the thing is, it's a motion that clearly has support in the room, but it has an implication, and that is that people need to be involved in that action group. So clearly the person who's proposed the motion will support it and she will be involved. You then need to, if you support and pass this motion, make sure that you put yourself forward to help. Because an action group isn't one person. This is a group that needs to be representative of the community and works toward the things that have to change that Dr. Patrick talked about, Dr. E talked about, that Fred mentioned. These are the things that you want, so your motion really is about forming an action group of people in the community to work in conjunction with the medical centre staff and professionals, in conjunction with the council and beyond to whatever extent needed. That's how I read or understand the motion, but it has implications for you. You must join. You must work together. You must support this. And voting for it is one thing. Being part of it is what's needed. And if you're clear on that, then I'll ask for a second to the motion. Thank you. Does that mean you'll also be part of it? There, you've got two. So you've got the,
Hey, you got another hand up.
The germ of an action group. There's three. Three women. I want a man. Be a man. Thank you. Please. Are you speaking to the motion or against it?
Jen.
Speak to the motion.
Yeah, well done, Jen.
Well, yes, I must call it to see if there's anyone who wishes to speak against the motion to form an action group.
I want to actually clarify that the action group doesn't need to involve everybody.
Of course.
It just needs a 2 or 3 representatives from, from it. I think it works better if it has the support of everybody and if it talks back to everybody, but not. Everybody doesn't have to go to all the meetings.
No, I agree. It's not about that. You have 4 people, including yourself, so far. So the point I'm making is that you may have a 5th, but the point is you have the germ of an action group. You have to vote to support it. And supporting it might be getting this petition out that was talked about earlier, or a number of other things. But it's a matter of if you elect or you support a motion to get this group together, then you need to support that group and help them do what they want. And that may mean how you vote in the September council elections, for example, to get what you want.
Jen might have something.
Are we going to call it the Medical Centre Action Group or?
I think
That's another night.
The title is something the action group works it out. Because it's not just about Dover, it's Geeveston and Dover working together.
Yeah. Jen?
It can be a whole lot of things. We don't need to solve that tonight.
No.
And you'll have, in your support of the action group, an opportunity, I'm sure, to come up with whatever name's going to work best. There'll be a whole lot of things that they will want community support for. So you're voting now for a motion that is going to call on all of you at some point, one way or another, but not coming to meetings like this. The action group has the meetings, makes the decision, feeds it back through the community in whatever way you communicate with each other and you support it. We're just going to diverge from the formal proceeding for 1 second to hear from Jen, because Bernie has an issue.
We didn't put these forms out on chairs. We weren't sure that the meeting would agree to move in the direction that it has, and I'd have to say that it has been absolutely wonderful to hear what you have said and the fact that this community wants to support both the Dover and Geeveston Medical Centres into the future. I have small A5 pieces of paper. They read, "Action I will help with to keep our medical centres with no less than the present number of doctors and staff." If you would please take one of these as you go out the door, or before you go out the door would be preferable. Put your name
If you
and
want.
an action, and it may well be that you're prepared to support a community group that functions as Rose has just asked. It may be something else that you're able to do. It has to be an action, and it has to be something that you will do. Not something for a committee to deal with, that's not the aim. And in relation to that last motion, I wholeheartedly support it and hope any number of you will put your name on this to support the community group.
Yeah.
Thanks, Jen. Okay, so you have this motion before you to form an action group, and you have a mover and seconder. Is there anyone wishing to speak against that motion? In which case, I can put it to you as a community. All those in favour of the motion, please say aye. All those against say no. Obviously the ayes have it. The motion is carried. You now have 4 motions that you've agreed as an outcome of this meeting. And they relate to a petition to get council moving. They relate to an action group, as you've just heard. They relate to the other things. We're getting the state and federal and council
Governments to work
levels
together.
of government to work together. It'll be all revealed in the outcomes when this is written up to the extent it's needed. I want to give you one more opportunity. Is there any other motions that aren't related to those 4, or the action that has been asked from Jen, that anybody wishes to put forward that relate to this? Okay, then I think my work isn't.
Just before you finish, I'd just like to remind everybody about the council elections in September. Remember, we haven't got anyone down here that represents us. So, if we can get somebody to put up their hands, to go on the council, to represent this area, please do so. But also remember, we only really need one person, not to vote against each other. We want one person in there to represent this area, and it is desperately needed.
Unrelated, but kind of political.
That's a lovely way to finish.
Yeah.
Here's your community. Here's an opportunity again for your community to work together. I think my job is done.
Yeah. Can we go?
We'll leave you. Have some closing remarks you wish to make. Thank
Got
you
enough
for
to digest,
your
haven't we?
involvement.
Really?
Thank you for making it easy. I didn't even need the bell.
You just got to process, but I can write a letter.
I'd just like
I can
to
write a
close
letter.
this evening by saying again, thank you very much. It's been wonderful to hear you. It's been really encouraging to see so many of you willing to help. I'd like to just follow up by saying that the intention now is to have a report from tonight's meeting, including those motions, circulated as widely as possible across the Dover Geeveston communities. Our attempt will be, with the help of the online centre, to get a report out by the end of the week.
Yeah.
That will be freely available. You are able to use any of the wording that is in that report that will come directly from the video of tonight's meeting. It will be public knowledge, and our wish is that it goes as broadly as possible. If you feel able to use the email sheet that's been given to you tonight, please do it immediately. You are asked to contact state government and local council on that email. If you wish to take that email further, please feel free to do so. Take it to the federal government. They're new, they're talking very much about what needs to be done across regional Australia in relation to primary health care. This would be an ideal time to get a pilot program or something equivalent in Dover and Geeveston. The last thing I want to say to you is please look for notices around town on Facebook and ask. We will run another meeting within the next 2 weeks if we possibly can. And we will deal with setting up a community group, call it what you wish, and we will deal with trying to get a much wider consultation process going between council, state government, federal government, the medical services and our own community. That's where we have talked, the few of us that have worked out tonight, there's been about 12 people really heavily involved, all from the local area. That's where we would like to see it go. We don't want to have to do it on our own, and I believe that from tonight we won't need to. I would like to say particularly thank you to our chairman, Jim's travelled down to help us out tonight. I'd also like to acknowledge our sound system.
Yes.
As you can see, we're in a school gym and there was no sound system. So Robert Brackenbury has made an extraordinary job to set up a sound system so that you are all able to take part in what's gone on this evening. So my very sincere thanks to these two gentlemen who've gone out of their way to support us.
Ready, Jen?
Thank you all of you. Go home safely.
Yeah, right. Yeah.